Hello, my name's Tim. Thanks for stopping by. I am a registered paramedic and I've currently just secured employment as a primary care trainee advanced clinical practitioner. You'll see from my poster, I have 5 real core elements, which I've kind of linked with my own potential progress because I'm just embarking on this role, with then the multi-professional framework for advanced clinical practice and how I see what I determine as the kind of core elements to develop my clinical practice, focusing on the clinical aspects of these 5 kind of ideas, of this kind of cycle of events, almost like a reflective cycle in a sense. So first of all, it's about role definition and scope of practice, to really understand exactly what my role is and what my confines are from my clinical practice perspective. I then move on to then the actual clinical practice and carrying out that work, interacting with patients, interacting with colleagues, and trying to provide the best care I possibly can for my patients. We then move on to the next cycle, which is reflection. Now, reflection, I think when we're advancing and learning more, it comes that little bit sooner than it perhaps would do when we're more experienced in our existing kind of foundation registrations. So I think we do a little bit and then reflect on it, and we do a little bit more and then reflect on it. Bringing that into then some level of clinical supervision to ensure that we are meeting regularly with senior colleagues and discussing cases, discussing areas for improvement, and trying to take forward some solutions as to whether that's more learning or more exposure or more shadowing in certain areas where we can have a look at senior colleagues and their working to determine some more understanding and potentially build some sensible, really emphasise that sensible levels of clinical confidence. And from that supervision, what we can take away then is some goals, and we can look then at setting some more goals. So whether that's working on consultation skills, working on clinical skills of examination, working on our understanding of pharmacology. And that way then, that was going to feed then, as we start advancing, back to the top of the cycle, which is that role definition and scope of practice, and whether that just affirms that role or affirms that area of practice, or actually through kind of mastery, what we then do is we expand the scope of practice slightly more with more experience. Now, this has obviously been linked directly to the framework and also to the College of Paramedics, which has a kind of integral framework around its paramedic, specialist paramedic, advanced paramedic, and then consultant paramedic route. So this will sit kind of almost in that inner third of the circle, and you'll see that from my poster. Well, thanks for stopping by, and I hope you enjoyed my short presentation and also the poster, and you can have a little read of my abstract too. Thanks very much for your time and attention. Keep well.